everyone. I'm Carla Macias, host of San Antonio's own medical show, Best Docs Network, the show that's guiding you to some of the best doctors in your area. Our show is also featuring one of the top medical facilities in Texas, Forest Park Medical Center, and their physician partners who are really changing people's lives. First on our show today is San Antonio urologist Dr. Timothy Hiavinka. Dr. Hiavinka specializes in issues with the bladder, female sexual dysfunction, women's pelvic health, prostate cancer, and erectile dysfunction. Let's take a look.
The symptoms that a patient would experience that would make them a candidate for the Interstim device are urinary leakage that is refractory to the traditional treatments of medications, diet alteration. When these treatments don't work, then the patient can be a candidate for the Interstim device.
My initial problem was having to constantly go to the bathroom, have sense of urgency. Someone recommended a doctor, and he recommended the Interstim procedure, and I had it done several years ago, and it worked very well. About a year ago, the battery died.
When Blanca came to me, like most of my patients who've had a pre-existing implant, I reevaluate them because the existing implant may not be the optimal one for her. So we almost have to start all over with a testing situation. Now in Blanca's case, we knew that she was going to get another implant because she had already had a successful implant. What we didn't know was whether or not the single wire that she had from her previous surgery would be adequate and we could simply replace the battery, or if she needed an additional wire and an additional battery. So she simply had to be retested.
Dr. Hiavinka recommended that I replace the battery and try a new system, a new device that was rechargeable. And so that's what we did. We replaced it. We started to do the initial testing in November, and then the battery was replaced in December.
Blanca got her battery replaced, and being such a young woman, we wanted to give her a very long battery life. Since her first implant, there has been the development of a rechargeable battery, which gives young patients many, many years of symptom-free problems by simply recharging the battery once or twice a week for 30 to 45 minutes by an external device. So I wanted to give her that option. She indeed chose that option. After about 6 weeks, she adapted and she's had good results now.
Today I feel good. I have really no problems with it. Dr. Hiavinka is very attentive. It takes the time to listen to what's happening to you. It's nice to have a doctor like that.
Stretching can help boost circulation and digestion. Remember, when stretching, to hold each position for about 25 seconds and to breathe deeply.
At Forest Park, we call it the 6 senses of Forest Park, and you have your conventional 5. And it talks about the experience that you get from the minute that you come onto our campus. So we're really kind of playing into those senses. So what are you seeing when you first get on the campus and walk into our hospitals? Are you looking at just great architecture? Are you looking at a brighter environment, with natural sunlight and things of that nature? The art program is something that plays into the healing aspect, the visual aspect. So you'll see sculpture, you'll see original pieces, you'll see prints, you'll see a little bit of everything. And the way that we attack art is you should feel a little bit uncomfortable with art, because if every piece of art in our facilities was something that you absolutely loved, then you probably didn't reach the entire community, because we all have different tastes, different aspects of what we like. What are you smelling? We have engineered scents in all of our hospitals to where it's an engineering system called ScentStream, and it's built into our HVAC, and the scent that Forest Park has chosen is called Clean Sheets. But other things that you have just kind of coming into our environment is, what type of food are you having, the taste. We don't have cafeterias, we have dining facilities. what are you hearing when you come onto our campus and into our facility as well? Oftentimes in every facility that we do, we have water features, both outdoor water features and interior water features. So it provides a calming type sound that resonates throughout our facilities. What are the things that you're feeling? We have a lot of textural elements associated with our design. When you're coming in, the textural walls, whether it's the stone-cut exterior of a lot of our facilities, or when you're coming inside and you're feeling the texture of the fabric itself. We really try to play into all of those senses for our patients. So, whether it's in the lobby or it's in the patient rooms, or the thread count on the sheets, those are the type of textural elements that really you may not instinctively know about those, but when you actually touch it and feel it, it'll make a difference to you. Every one of our facilities is a minimum of LEED Silver. So what that means is it's our environmental impact to the community as well. So we have rooftop gardens where you have lush gardens that can be seen from all of our patient rooms. You're seeing planting, you're seeing stone, you're seeing in some cases water features associated with even our green roofs. But it's something that really kind of plays into the sixth sense of Forest Park, which is heal. And having a patient room that looks down onto grasses and trees and plants, and it intrinsically has a healing aspect that really our patients have grown to appreciate. Again, we're playing to each of those senses, and then our sixth sense is heal, because at the end of the day, that's why we're here. We're here for the community, we're healing patients, and providing a place for our physicians to practice medicine. Walking onto our campuses from step one, what we really kind of focus on is that entire experience. It should look and feel not like a hospital, but it should look more like a hotel. You're really seeing something different. It has a completely different feel from anything else that you've seen in the market. Our job as developers and as Forest Park Medical Center is to deliver a facility that's different than what the physicians are used to, what the patients are used to.
National Hospital Week celebrates hospitals and the men and women who support the health of their communities through dedication and compassionate care. This year, Hospital Week was held on May 10th through the 16th. Now let's take a look into one of the many celebrations held at Forest Park Medical Center, San Antonio for Hospital Appreciation Week.
Today we're celebrating National Hospital Week, and we're providing a free lunch for all of our employees and any patient families that may be coming by. We're featuring some barbecue chicken, some roast pork loin, and some healthy sides to go with that. And we're hoping that everybody will come down and really enjoy their special day.
We are so excited to celebrate our first hospital week ever at San Antonio Forest Park. It's been a wonderful week of giving back to our employees, which make us so special. We get to hear every day about how great our facility is. It is truly the people that walk the halls and address our patients and families that are really our most valuable asset.
Today was interesting because we got all of our food served by the C-suite and by other individuals that are directors in the hospital. And it was just a lot of fun seeing the directors with the bouffant caps and, getting behind the lines and actually serving us the food. It was kind of comical. The food was excellent. In fact, we were all commenting about how wonderful the food was. We've been having fun events every day as far as like cupcake contests, and I think Friday we have a salsa contest.
We let the employees pick out one of their favorite menu items and have the executive team serve them their free lunch today. And it's been a blast. They give to us every day and give so much. We want to give just a little bit back to them.
Here at Forest Park, we operate what we like to feel is a restaurant within a hotel. So we're offering a higher quality of food and service that's in line with the fine hospital that we are operating here.
We just appreciate being recognized by our administration for everything that we do. It's been a fun week. It's been quite an adventure seeing everything come together from when we didn't have anything here in the hospital and seeing how it is today. I love working with the people, the physician. It's been great.
Erin has a question for Dr. Sayeed. What are some of the causes that would lead someone to have a revision of a total joint replacement?
Some of the more common causes of needing a revision total joint replacement are implant wear, implant loosening, dislocation, as well as a small chance of an infection. As with any surgery, there's always a chance of an infection, and this also goes for total joint replacement surgery.
So what is shingles? When you get chickenpox as a child, the virus goes dormant on the spinal cord, and then later on in life it reactivates and it creates a band lag rash that is usually very painful in one half of your body. It could be on your face or in any other part of your body. This rash sometimes can be preceded by pain, or it could be described as numbness or tingling in the area where the rash is going to come out, and this can be preceded by sometimes up to a week. Anybody can get shingles, but it is more common in people who are immunosuppressed, either from chemotherapy or because they're taking immunosuppressants to treat diseases like organ transplants, or lupus, or rheumatoid arthritis, or psoriasis. This rash will present as blisters on top of a red base, then they crust, and eventually they move into new crops, and eventually they will subside. It can take up to a month for this rash to go away. Once you get shingles, you are contagious until the rash completely dries up. You are contagious to people that have never had chickenpox or kids that have not been vaccinated against chickenpox. Once you get the rash, make sure you see a doctor, as you want to start treatment within the first 48 hours. This is treated with an antiviral agent, and if you're a candidate, they may use also a steroid to reduce the inflammation of the nerve. There is a vaccine that may reduce your chances of getting shingles. It is called Zostavax, and it is indicated after the age of 60. So talk to your doctor to see if you're a candidate for this vaccine, as it cannot be given to everybody, since it has a live virus.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health. For more information on any of the doctors you've seen on today's show, log on to bestdocsnetwork.com. From there, you can click on San Antonio under the Our Doctors tab. You can also browse through all the different doctor specialties a part of this network and check out more educational videos. Now let's continue with today's show with pain management specialist, Dr. James Growney.
Back pain is terrible. You hear people talk about it, but you just don't realize it till it happens to you. It began several years ago with a herniated cervical 6-7. I had a problem with my middle back. I had some trigger points, and then I ended up getting trigger point injections in my mid back, and then all of a sudden that evening I had terrible low back pain.
Joan first came to me about 2 years ago and was referred for continuing neck pain. She had had a neck fusion, did well in that regard, but had some continued complaints. The long stretches of playing her instrument led to some pain, which limited her activities.
It's very limiting. You feel very weak. It can be just overwhelming. I mean, the amount of pain. It makes work difficult. It makes sitting at a computer difficult. I'm a violinist, a professional violinist, and for some reason, sitting in a chair, just holding up this instrument, it affects my back. Sitting in general is more of a problem. If I could get up every day and just walk all day long, I'm better off.
She had a couple of options initially. One was an epidural injection, and then a second option was the use of what we call medial branch block. The epidurals are for the cervical or neck area and the lower back or lumbar area. It's a location the medication can be placed to reach various nerves and nerve roots.
Dr. Growney thought that cortisone was clearly what we should do. And we did do one shot, and it was miraculous. I mean, I've never had any issues, and that was a couple years ago now. It's not that common to be able to get away with just one shot. Dr. Growney is a wonderful physician. He will talk all your options through with you. Any questions you have, you are welcome to ask. He will answer them. You're dealing with patients that are in a lot of pain. It's great to have a doctor that will listen.
I had the privilege and blessing to participate in the humanitarian mission to Rwanda, and I'm part of the Face the Future Foundation team. The Face the Future Foundation team is a pro bono organization which brings together a team of some of the best surgeons in the country to go to Rwanda, a country which has been ravaged by genocide and really has not had a plastic surgeon in country for the last 25 years. And so we go as a team and offer comprehensive facial plastic surgery. And the United States was so blessed and privileged to have craniofacial surgeons and facial plastic surgeons which provide comprehensive cleft lip and palate care. In places like Rwanda, this care is not available. That's why I go to Rwanda, because I feel like I could bring a comprehensive approach to either treat the baby with a cleft lip and palate deformity, the child with a jaw abnormality, or the adult with a bite problem. Last year and this coming year, we treated patients with head and neck cancer and head and neck tumors. There are patients with tumors who are very large, very disfiguring, and we were able to treat those patients in Rwanda. We treated a child with an ameloblastoma. It's a skull-based tumor which had displaced the child's eye, and the child had difficulty seeing and had a disfiguring deformity which caused the child really a lot of emotional problems, as well as there was remaining tumor which was not removed. And so myself and Dr. Long from the Cleveland Clinic and Dr. Bohemi from Johns Hopkins did a combination surgery to remove the tumor, reconstruct the orbit, and then use a leg bone, the fibula, to reconstruct the face. The child woke up and touched his face and smiled for the first time in years. The medical system in Rwanda is really growing and it's really improving, and I believe that in future years and with a continued partnership with humanitarian organizations such as Face the Future Foundation, I think that Rwanda will have an improved healthcare system in years to come.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Cardiology is a medical specialty that deals with disorders of the heart. Dr. Jarrett McGehee is an interventional cardiologist here in the San Antonio area. Now let's meet the doctor.
My aspect of patient care is to kind of speak on the patient's level is the most important thing, I think, and then establish a good rapport with the patient, answer their questions, make good eye contact. I chose cardiology because it's a practice where I deal one-on-one with patient care in addition to procedural-based patient care. In our practice, we have a regular clinic and we do diagnostic imaging, including echocardiography. We do chemical and exercise stress tests, stress echoes, venous Dopplers, arterial Dopplers, carotid Dopplers. We go to various hospitals in the area, including Forest Park, to do interventional procedures, including peripheral vascular interventions and coronary vascular interventions.
Currently in the OR manager position. I oversee the nurses, our RNs, our scrub techs, all of the individuals that are necessary to smooth running of the facility in the operating room. Monitor the operating room schedule to keep everything running on time as well as meeting the needs of our patients and our physicians. I decided very early on that I wanted to be a nurse. I enjoy people. I enjoy being able to serve the needs of others, and the operating room just really stood out to me. I think the OR is an area that's it's very scheduled, it's very routine. I like to be able to plan. One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated. The physicians, everybody is just wonderful. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view. One of the main reasons that physicians do enjoy coming to our facility is just with the extents that we do go to meet their demands and also provide them with what they would like for their cases. We want all of our physicians to have what they need to provide effective, safe surgery, but also to meet their preferences of what they would like.
If you're ready to request an appointment with any of the doctors you've seen on our show, or for more information on Forest Park Medical Center, head on over to bestdocsnetwork.com. One of the Forest Park physicians you can find on our site is cardiac and thoracic surgeon, Dr. Francisco Rodriguez. Now let's listen as Dr. Rodriguez helps save one of these patients' lives.
When I was at work, I'm an urgent care nurse, and I was tending to a patient when I suddenly had this squeezing in my chest. Being a nurse, the first thing you do is you just deny it. But it lasted for probably a good 30, 45 seconds, so I had the nurse practitioner do an EKG on me, and it was completely normal. Went back to work, just didn't feel myself. Texted a good friend of mine who's a cardiologist here in San Antonio. He told me to stop fooling around and go straight to his office.
Joe unknowingly had a family history of heart disease. When he started having some pain, he chose not to ignore it and went to see his cardiologist, who did a full evaluation. Even though some of the tests were negative because of his history and his symptoms, took him to the catheterization lab and looked at all of his heart blood vessels. Once he found he had all major vessels in his heart with disease, he felt he would have been best served by bypassing his coronary arteries. At that point, he ended up putting a device in him to help rest his heart and gave me a call.
The cardiologist went out and spoke with my wife, and he told her, there's nothing I can do for him. This is beyond what I thought it was. I had multiple occlusions, and I was pretty much 99% occluded around my heart. So he had to make an emergent call, and Dr. Rodriguez came in pretty much to save the day just at the last minute and performed open heart surgery.
In the areas they're blocked, we bypass them. So these bypasses go from above the blockage to below the blockage, allowing blood flow to return to normal to your heart muscle. And what this does is prevent it from having a heart attack. Most people will have drastic improvement in symptoms.
It's been 3 months now since the surgery, and it's just now that I'm feeling normal again. But I'm very grateful because there would be no life if it weren't for the surgery that was performed.
5-star treatment, 5-star service in a 5-star setting.
As a state-of-the-art medical facility, Forest Park Medical Center is unrivaled. So, naturally, it's where the finest physicians in North Texas want to work. And because of the extraordinary level of comfort and care provided to our patients, Forest Park Medical Center is where they prefer to come to. We're just happy we could bring them together. Come experience for yourself what medical care was meant to be. Forest Park Medical Center, your destination to better health.
Lindsay has a question for Dr. Chou. If I have or had cancer, at what risk are my female relatives at?
Depends on if they are in a first degree or second degree. The first degree in the breast cancer genetics is your sisters, your mother, and your daughters. The risk of having a breast cancer in a lifetime is 1 in 8. If you have a first degree relative, then your risk doubles. So it's very important that you would actually be interested in coming to the breast clinic to get assessment and see what breast cancer screening starting at what age.
Thank you, everyone, for joining us on another episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. Now, if you didn't find the doctor that you were looking for on today's episode, don't worry, just head on over to bestdocsnetwork.com. Got any questions or comments or a great story about one of your physicians? Email us at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.